Thank you, everyone, for attending and all your time today. I'd like to start out and let anyone who has a conflict of interest go ahead and disclose that now. Seeing none, we'll move to the next item, which is the mission statement. And Dr. Nettles, would you be kind enough to read that?
Mission statement: to improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice.
Thank you. Next item on the agenda is public comment. Ms. Lesser, and
There are none.
okay, thank you, Ms. Lesser. The next is the minutes. Everyone has had a chance to review the finance meeting minutes for June 26th. Okay, accept a motion to approve. So, and second, any discussion? Seeing none, all in favor? Aye. Next item on the agenda is contracts. Dr. Mark Brown for the Fujifilm contract. Thank you.
Good afternoon, Madam Chair and board members. This is a contract that has come to the board back in February. It was the 3D mammo unit that was in Bordeaux. And so we're bringing that back. We delayed that for 6 months. It's a $36,000 annual contract. And then I did do some research on that. It's not recommended by any regulatory body or anything, but the repair cost on that machine averages around $15,000 to $20,000 when it needs to be repaired. So if we had several repairs, we would bypass the annual cost of that contract. Also, it's highly recommended in best practice according to the ACR, the American College of Radiology, and the Mammo Quality Standard Act to make sure that we're emitting the correct radiation and dosage to the patient.
Any comments or questions regarding this contract? Okay. I just wanted to ask a quick question on the contract, the board approval part. There was not in the 3 boxes, there wasn't a check mark as to which this one. I would assume that this is a non-medical professional services contract, the middle one?
Correct.
Okay.
Yes, ma'am. It's
Okay.
a maintenance contract.
Maintenance contract.
You're welcome. Sorry about that.
That's okay. I just want to make sure that we had it accurate. The only other thing I think that would be helpful, in addition, I know we've continued to evolve this contract summary information sheet, which I think is fabulous from where we started with, which was not really having inconsistency among departments. This is, y'all have really done an excellent job, and thank you for working on these and making these better. When we have on the second page, page 204, it says, did this vendor undergo the RFP process? Yes or no? And then it gives the vendor information. I know that we have why a certain vendor was selected, but maybe under if we mark no, we might want to add
A comment.
if not why.
Okay.
So I think that would be helpful from a going forward perspective, because especially if the information is not filled out and discussed in the page 3 of 4, where we talk about, in this case, it says service engineers are trained only for Fuji equipment, yada, yada, yada. I think that it's not always discussed there. That's it.
Okay. Thank you.
Well, I agree to that, because I think that adds to the credibility that also you continue to do your due diligence and looking to see if indeed there were some other vendors available or newer products that are out that we may not know about.
Yes.
But
Okay. Thank you, Dr. Nettles.
So it looks like the same cost from last year, annual, and auto, not an auto renew. So this one will come back in 2 years. Is that
Yes,
right? Okay.
correct.
Great. Any other questions for Dr. Brown, Dr. Nettles? If not, I will accept a motion for approval of the Fujifilm contract. Okay, second. Seeing no further discussion, all in favor? Aye, motion passes. Next on the agenda is the GEBBS Healthcare Solutions contract. Dr. Blackledge.
Sure, at this time, I will introduce Yasmin Wood. She serves as our Director of Health Information Management. She will be presenting the contract.
So I'm bringing forth an amendment to the existing GEBBS contract that would expand the coding services that they currently provide for us. This will replace our current medical coding contract that we have with Code. At the beginning of this fiscal year, we performed a cost analysis between the two coding vendors, Code and GEBBS, to identify potential cost savings. GEBBS utilizes an offshore coding team, which allows for their pricing to be significantly lower than Code, whose coding team is based in the U.S. As a result of this comparison, we found that we would have an annual reduction in cost of approximately $536,000. GEBBS has completed the professional coding component for the NGH employee radiologist since fiscal year 21. So GEBBS has been a coding vendor partner for NGH for 4 years. And with that, GEBBS currently conducts monthly audits to ensure 95% or greater accuracy rate for each coder and provides that audit information back to NGH. So with the expansion of these services, GEBBS will continue to follow that same practice. And in addition, our coding manager will also complete quarterly audits to ensure that the 95% accuracy quality standard is maintained.
In reading through this contract and looking at the savings, I mean, this is really dramatic. So I applaud you and your department for being able to find these cost savings. I mean, it's, over $500,000 a year that you're able to find and then save this hospital and then allow that money to be used in a more efficient way and hope, patient facing. So thank you for the work there. I want to point that out and make sure that that's definitely noted for the minutes and for anybody listening. Yes, ma'am.
If I may add, this is keeping in line with our cost reduction, cost cutting strategies, and to provide the best quality care in terms of the work that we do in the most efficient manner for us.
Thank you, Dr. Blackledge. Dr. Nettles, any questions or comments? Okay. All right. See no other presentation points. I will accept a move for approval of the GEBBS Healthcare Solutions contract.
So moved.
I'll second that. If there's no further discussion, all in favor?
Aye.
Aye, motion passes. Next up is financial statements. Dr. Blackledge. And then we'll just let you go. Well, sorry, financial statements and then revenue cycle.
All right, we will go in that order. Before we begin our financial statements, I want to give two updates. One update on the KPMG progress to date. I just want to make sure I share with our team and everyone here that from the KPMG standpoint, where we are today is working on our deliverables. So that's receiving the tools from all of the work that has occurred over these last 60 days or so. So receiving those tools, and we have began to operationalize those tools. So this month of August is for us about operationalizing those tools. In addition to that, as I move to the second dot point, which is around our audit preparation. So our audit with Crossland typically occurs in the month of September. So we are going ahead, since we have ended the year and we're holding this board meeting today, we're going ahead to begin to prepare for our audit piece. And so that means opening up communication with Crossland, discussing the timeline that they have shared with us. And also, if there is an opportunity, we want to advance that timeline and begin sooner. And with that, I will turn it over to Ray, our controller, to walk us through the financials, and then I'll be back to talk about the revenue cycle component. Thank you.
Okay. Hi, everyone. Looking at the income statement first, for the current month, a couple of things to point out. First is along the revenue line. You can see $24,256,000 for the actual compared to $28,148,000 for the budget. So under the budget, 13.8%. which is exceeding what we've done year to date, 12%, and that's been kind of a trend since, I guess, April or so. So that's one thing to call out there. I know Dr. Blackledge is going to follow up on that with some more information about plans going forward. And then on the funding line, the additional state funding, we've got some additional funds there, some of the HIP funds, but under the city subsidy, you'll see the $11,582,000 compared to a budget of $4.9 million. And that has to do with us receiving the rest of our subsidy, $4.9 million plus another $1.5 million. And then also related to the Meharry lease of $6.6 million. So that's what comprises that figure. And then jumping on down to expenses, looking at salaries line, you can see it's $5.4 million on a budget of $5 million. Which is $368,000 over budget, but it is more in line with the budget compared to previous months in the fiscal year. And we expect that number to continue to come down to meeting our budget number improvements into this month, this current month for July. And on down to under expenses, under leases and utilities, $8.1 million on a budget of $948,000. There was an entry for the Meharry lease, again, the building addendum 3, of $5.3 million, along with expense recognition for Cerner of $2.3 million. And then on that next line below for interest, we have $1,587,000. That is the interest associated with the Meharry lease. And that's all I have as highlights for the current month. Any questions?
Just a clarification. So thank you for pointing all of that out. And I know I've asked the question before, so just for, our committee's sake, I'd just like for you, if you don't mind, to just recognize not just the number, but why they haven't been in the budget before.
Related to the lease, Meharry lease?
Meharry lease and the interest amount, correct? Mm-hmm. And the Cerner piece, which is, you said $2.3 million.
Yes, the related to the Meharry lease, that is something that we've known about. I don't know if you talk about that.
So the decision was made, number one, we received the funds in this same month. The right part of the $6 million is in this 11.58. So if you look on the city subsidy line, you've received the funds, right? So that's receiving. Mm-hmm. And so where do we illustrate or show those funds going? And so those funds are there. Now, the discussion that we have to have internally is when we look back in the past, where has that line item been included in the past? Mm-hmm. So this was an internal discussion with our KPMG team and our internal team members, and we actually need to show where the funds are. We need to show where all of our funds are. And so while I can't answer several of the other questions that relate to several years ago or in the past, I can answer, here's where we recognize that payment that's related to the building and other Meharry items, and that's where we recognize the interest that's associated with it.
And what about the Cerner piece?
Now, the Cerner piece was $2.3 million, so I'm not sure about, I don't have the detail.
Okay.
Yeah, I would have to defer that until I can get the actual details for you, Christy.
Okay, great.
Or Madam Chair, that's what I should say. I know, right?
Christy, it's fine. Any other questions on the income statement? Dr. Nettles, anything from you? I would just personally like to say that I'm very pleased with KPMG on the process. I know I'm kept up to date regularly on the movements being made with their financial analysis and to really compliment you and your team and the work they're doing. I mean, it's different and it's change.
Yes.
And that's hard. and nobody likes to change. So I appreciate that that's difficult. I thank your department for leaning in and really wanting to work the problem. And I realize that there's not always an answer. We may not even have the answers from, yesteryear, but I appreciate the work that's being done to understand and make those corrections going forward and make sure that things are categorized appropriately. So I appreciate that from you guys. And getting the parts of these different line items in budget. And that doesn't happen immediately, but the work that's been done over the past few months, and I mean few months, not even 2 quarters, but few months, is just tremendous to make some of these month-over-month changes. And you see how they impact our, year-to-date kind of fiscal year end. And then also just a big shout out to Metro itself. So I'd like to personally thank Metro government, the support they have given us and received, our Mayor Freddie O'Connell and Janine, her team. It's just been tremendous, the partnership that Metro has given us at this point. And so we could not have done that with them. We could not have done that without Metro Council passing this for us. And so I appreciate all the support the Metro Council has given this hospital and expect great things is what I would say. So enough of that.
I'd like to go on record as saying that I agree with all of that totally, and also appreciate the initiative to investigate and ask the hard questions that have not been asked. I think that takes a lot to do that.
Well, on behalf of all of the employees at Nashville General Hospital, I just want to say thank you and show the spirit of gratitude to Metro and to everybody on the board and all the team members that have contributed. I heard Madam Chair use 3 words: different, change, and hard. And so I'm a 3 girl. You hear most things come in 3s. And so when I hear those things and recognizing that the work that we've did and the work that we will continue to do in the future, that's probably most important for us as we continue to organize ourselves in a way that we can execute from day to day. Jump right into the revenue cycle? Or do you, was there? Okay. All right, we can move into the revenue cycle component. If I can turn my pages. Yeah, and I don't think we discussed some of the revenue cycle components in our last board meeting. But as it relates to cash performance and looking at the cash that has been collected, I do want to point out December 14th was the go live to Cerner. We recognize that that takes time. But more importantly, when we look at the trend for March, April, May, and June, we do see that trend upwards, very much like a couple of the trends that we briefly touched on from the expense categories on the income statement. While we see many of those trending down, we want to make sure that the cash line is trending up. We typically in this business, we look at a period of time. We don't look at one 30-month. Not 30 months, but 1 30-day trend. We look at a period of time, so that's about 12 months you want to look at. And so we want to continue this efforting, and it is a result of having a team get together, focus on their issues, be transparent about their issues. You see a number of emails flying every day, and I don't believe that that's always good. But what it does represent is communication. It does represent a team getting together, working on issues. And those issues result in what we're seeing, and that's the outcomes of cash performance. So strong cash performance indicators as you look at that as a percentage of the net revenue. If we go to the next slide and look at the unbilled inventory, this is where our teams are spending the greatest bulk of the time. And I want to slow down and just share. So what our teams are doing now that we've gotten past the conversion, they're focused on everything that is old. Not that they're not focused on the new items, they are, but there is a level of concentration on aged inventory. So as they do that, they have to go back and revisit items in what we call the claims scrubber and edits. And so as they correct those, we see the differences in the unbilled days. So they ended June at 5.66. And that's because of a series of projects. that deal with aged inventory. And then the last component is the denials management piece. And this deals with our insurance providers and making sure that the teams are following the rules that are required for us to submit information to the insurance providers around the patient and the care that has been delivered. And so as a result of the teams getting together, inquiring, having meetings, taking the actions that are needed and executing, we see the benefit here. And so you're seeing a decrease in our initial denials that are being worked. And it's not just the revenue cycle team. It's the caregivers on the floors, it's all of nursing, it's radiology, it's all of the areas, the lab area. So all of the areas come together and focus on what we can do to prevent this. And the biggest key and piece to this is staying updated with the insurance provider. So there's a lot of work that goes on behind the scenes because, as you guys are probably reading, these things change every day as it relates to readmissions, as it relates to insurance coverage, as it relates to getting authorization to have a treatment or a service within a healthcare entity. And so we all come together to make sure we focus on this line and this piece of our business. And I will take any questions from myself or Ray.
I had a question just real quickly about the accounts payable slide.
Yep.
If you could spend a little time on that one.
The 41.
Yes.
You want to take that one? Or do you have- And so while Ray's getting to the page,
Yeah.
I'll go ahead and start it. You want me to start?
No, go ahead. Go ahead.
Yeah, I'll go ahead and start it. So number one, we're focused on the AP side of the business. What we have observed with AP, and I'll give it just from a high level, is what we've observed is I'll just use $20 million. So we were at $20 million at a point in time. I'm just going to say I think that was May or 20-something in AP. So what we're seeing is based on some of the activity that started in February, March, April, and moving forward, we see a decrease in the overall AP. Now, what we do see is we have continued growth in the aging greater than 90. And so how we strategize, how we plan, how we execute has been something that the team has been pulling together to see what is the best way to do that. But that's how what you're seeing in some of the decreases is a result of that activity, decreasing the overall AP. Second to that, the method that's being used is every day Ray and team get together. They go over some discussions. They answer a series of questions. This includes feedback from the operators via email, via conversations, via meetings. And so every day they're paying out AP. Now, do we want to make AP payments every day? No, we really don't want to do that every day. There's an administrative cost associated with that activity every day. However, in our current situation, it's critical. And so from there, I'll pass it on to Ray to share more details or color commentary.
Yes, thank you. Yeah, that's one of the hardest things that we have to do right now, which is essentially operate, and we've all been there, you know, we operate, we have limited funds, and we got more bills than we got money. And so that's kind of the situation that we're in. And so to manage that, we meet every day and look at what is, like Dr. Blackledge said, what is, you know, the highest, what's critical, what's being, you know, what services are being put on hold or that are way past due. We're getting cut off. We can't get supplies. We have to. So it's a very, very difficult situation to operate in, and it impacts the whole staff. But I know it impacts the whole hospital too, and so that has been very difficult. But we do it every day. We joyfully meet and try to figure out what we can do and do it again the next day.
So the 41 days is a representation as a blended value, or are they not the aged in the current?
That directly has something directly to do with the Meharry. It was a huge payable that kind of came in, and so that made the numbers appear like they dropped, which they really did not. I mean, we could have excluded that, but it was a payable.
Understood. Okay, so that was part of that amount that came in. Gotcha. What do we think the accurate number is? Do we have
It would be much closer to that 87 number it was
around
the
87?
previous
Okay.
month.
All right. and again, no blame. It's somewhat of a lack of a better term, an inherited problem. But the goal is to not continue to have them age and continue to grow the revenue. But it's just good to be knowledgeable about what we are.
Yeah, it's just the reality.
And right, be in reality and be live in transparency. And so when you're making decisions, we want to obviously be true to the numbers going forward. And I think that's just good to be able to understand that. So thank you for that explanation.
Right. And Madam Chair, as we sit here and hear you, that's a good place for a note. It's just that simple. That's a good place for us to add a note. Mm-hmm. Like if there's an issue like that, there's a good place to add a note on the 41. Yep.
Yes, Dr. Elders, please.
Yeah, I just wanted to say I wanted to congratulate the finance team and all the hard work and partnership that they've done with KPMG. We do plan to provide a 120-day, somewhere around there, look back on where we were financially to the board at the next board meeting. And so we want to share all of the cost-saving strategies that we have completed, as well as the KPMG workout. And there's been tremendous amount of work and collaboration across that team, and we just thank them for their hard work.
Great. Okay, wonderful. Thank you for the report. Anything else from you and your team, Dr. Blackledge?
Not at this time.
Okay. All right, great. So that takes care of the financial statements and the revenue cycle.
No. Informational only.
Yeah. So, Dr. Nettles, any other questions or comments from you as a committee member? No. Wonderful. Thank you, everybody, for their time. Our next Finance Committee meeting is Thursday, 28th at 3 o'clock. So I will move for an adjournment. Thank you. Second. Thank
you.